Healthcare professionals often get laxatives mixed up. They understand what laxatives do, but they don't all work in the same way. So laxatives help relieve constipation, which is what most people know, but they work in very different types of ways. So there's 5 main ones that I'm going to talk about now. And the first one being bulk forming laxatives, like fibre gel that you may have heard of. These act like a sponge and they absorb water into the bowel to make the stool bigger and softer, which helps to then stimulate the bowel naturally. Patients need to drink plenty of fluids with these ones. The second type is osmotic laxatives, like lactulose or macrogol are the ones that you probably come across, and these pull water into the bowel. This softens the stool and makes it easier to pass. These can take a day or two to work, so they're used if we don't need constipation relief immediately. There's then stimulant laxatives like Senokot that you may have heard of, and these directly stimulate the bowel muscles to contract. These often work a bit faster and they're usually given overnight, so they'll be given at night time, but these can cause stomach cramping, so just look out for signs of this as well. Then we have stool softeners like Doxate, which help water and fat mix into the stool. This makes it softer and easier for it to pass. And then you have your things like suppositories and enemas, which work lower down in the bowel, in the rectum. So these are often used for a quicker relief of constipation if needed. It depends on what the patient's symptoms are, why they've got the constipation. They may have had different types of surgery, so it will depend on which type they are prescribed. But the memory trick on each one tends to be that the bulk ones build, the osmotic one draws, because it draws the fluid, the stimulants squeeze the bowel, the softeners soften, and the enemas empty. Hope this helps.